What you and I see here in these two charts representing individuals suffering from the challenge of cardiomyovasculopathy, which basically is these triglycerides or lipids that accumulate around the heart, often contributing to heart failure. Now, what we have between these two groups, or two charts, is a 3 to 5 year period of time representing the survival of individuals that were taking Tricaprin, this triglyceride, which is often found in things like the MCTs, which we'll go into in a second, and those that were not, is quite astounding. It's almost criminal, the fact that there was a control group at all, because the ones taking Tricaprin, at least in reference to the study, and remember this is for educational purposes, was 100% survival. So we do need to have further studies, but right now, you can't ask for anything more promising than that in regard to cardiomyovasculopathy, as opposed to heart transplants, so on and so forth. So without further ado, let's get right into the study. It's kind of odd using a triglyceride to combat a triglyceride. To proceed, a simple supplement improves survival in patients with a new type of heart disease. Heart transplant is a scary and serious surgery with high cost, but for patients with heart failure, it can be the only option for cure. Now, however, a multi-institutional research team led by Osaka University has found that simply taking a supplement might be all that is needed for certain patients with heart failure to recover, and I am quoting, no surgery needed. In a study published in Nature Cardiovascular Research, the research team found that Tricaprin, a natural supplement, can improve long-term survival and recovery from heart failure in patients with triglyceride deposit cardiomyovasculopathy, otherwise known as TGCV. TGCV, this triglyceride deposit cardiomyovasculopathy, is a new type of heart disease, diagnosis-wise at least. It results from an impaired ability of the heart and smooth muscle cells to break down triglycerides. Therefore, you see the confounding a triglyceride to help combat a triglyceride. Moving forward, which are a type of fat. Triglyceride accumulation in the cells causes structural and functional damage in the heart and blood vessels. These changes result in clogged arteries and weakened heart muscles, which may cause debilitating symptoms and eventually heart failure, necessitating heart transplantation. Now, I use Gemini here to give you an idea of the triglyceride makeup, or I should say the Tricaprin makeup, like for example of a common MCT, and take that for what it's worth. But to proceed, not only did the positive effects on patient symptoms continue, but the function of the heart muscle improved and structural changes that had developed were reversed as well, quoting the researcher. All the enrolled patients initially had heart failure. Nevertheless, the 3 and 5 year survival rates were significantly higher in the Tricaprin group, 100% and 100% respectively. I'm going to bring back that chart real fast because now it probably makes more sense. You see the 100 and 100 towards the top? To proceed. Compared with the control group, 78.6 and 68.1 respectively. Another favorable result was that several patients who had positive effects with Tricaprin were on hemodialysis. These patients normally have very poor prognosis without Tricaprin. Spreading awareness of the disease to achieve early diagnosis and treatment offers patients the best chance of recovery, quoting the researcher. All right, let's bring up one of these case studies again of an individual that was doing the Tricaprin. You notice the X-ray charts there? You see the difference? And again, see the little line highlighted there as well? To proceed. Conclusion. Our study offers a classification of heart disease caused by defective lipolysis and its possible practical treatment. Because myocardial lipid droplets are a common feature in heart failure, and their potential as a therapeutic target has been discussed worldwide, quoting, our findings warrant investigation and other ethnicities as well. Now, to proceed, a little bit of a technical graphic in regard to the postulate how the Tricaprin works. Pretty fascinating. But this is overall, you can't get a better result than 100% and 100% in a reversal in some cases, at least in this pilot study. But wow, you talk about miraculous. If this actually gets confirmed in future studies and works for the general populace as opposed to the small study group with the same impact, that really truly is a miraculous discovery. Again, gratitude to the researchers. It's very important to show appreciation, as well as me showing appreciation for you watching, and look forward to see what you and I both discover next week. Catch you all next time. See you then.